342 and 48 deaths. Now, there were 2 new deaths today, one in the 30 to 39 age bracket, and based on the health department's press conference at 11:45 today, they confirmed that that person did not have any underlying conditions. So that's kind of a scary deal there. But you can probably get more information on that by watching or listening to that press conference or going to covid.sd.gov, which is where the source of these numbers are from. So just a few things from me tonight. The back to normal plan is kind of in full swing. Obviously, we still need to do social and physical distancing. That still needs to be observed for probably the foreseeable future, if not into the fall. Masks are still a priority when out in public or near others. If you feel you need to wear a mask, make sure you're wearing one. If you're out in public, in groups, stores, whatever the case is, make sure that you do have one available or that you're wearing one. And then know your local regulations. Over the last few weeks, there's been a lot of ordinances that have been allowed to expire or get revamped based on kind of the back to normal plan. So just know what's out there in your area and what people can and can't be doing. So again, don't let your guard down. That virus is still out there. As we see today, I think we had 73 new cases today, 10 in Brown County. The numbers do continue to climb, which is the health department has said those numbers are going to continue to climb. The main focus now is on hospital beds, and I'm sure one of our guests tonight is going to be kind of talking a little bit about that. Make sure you're still wearing your PPE, and make sure that you're still keeping account on your PPE, making sure you still know what you have, making sure that you're not going to end up running out or running low or anything like that. So just make sure that you still know how much you have and know that you have enough in the event that you do get a patient who has COVID or is exhibiting the signs and symptoms, so you don't run out. Some new CDC guidelines were put out either today or yesterday. I didn't catch all that. But the one big one that jumped out to me was the close contact. Used to be a close contact was considered a close contact if you were near that person for 5 minutes, within 6 feet of that person for 5 minutes. The CDC has pushed that out to 15 minutes. That was talked about as well today in the 2 o'clock press conference, I believe, with Governor Nome and Secretary Malcolm Rasdon. Some other changes, and then the current guidelines can be found at cdc.gov. We're not going to go through all those tonight, but make sure you are logging on to that as often as you can, so you are up to date on what the CDC is recommending. Just an update on EMT testing, EMR testing, if any of you in your areas are dealing with this. I know we are dealing with this. And then also recertifying. So on the recertifying side, first off, is that new deadline is fast approaching. So make sure you're getting your hours logged and getting restarted at the state level. For those of you that have already restarted at the national level, but maybe not at the state level, just make sure you're going through the motions that you need to there. Also, some very exciting news that Lance shared with me yesterday, and a big shout out to Lance Iverson with the state EMS office. He's been doing a phenomenal job being our point of contact with the National Registry on getting people or getting information on when we're going to have testing centers open. And we also ran into an issue with the online version that Pearson VUE is putting out. They call it OnView. For about the last week and a half, that is was supposed to be online and ready to go. But if you had an EMT student who had already paid for their test to do it on site or in a testing center, they were unable to go in and change that they wanted to do it online. So I'm very happy to let everybody know that that has been fixed. And we are going to have, out of a class that I was teaching, we are going to have our first people doing the OnView online EMT testing starting tomorrow morning. So I will report back to you guys on that. And if any of you are in the same boat as I am with classes that finished, but we couldn't get people tested, reach out to me. I'll give you all the info that I have the students have also been doing a phenomenal job at studying and also making contact with NREMT to make sure that things were going smoothly. But on the testing centers side of things, is we are going to be seeing some testing centers reopen probably after 5 o'clock, and then also on Saturdays to get EMS folks tested. So contact your testing center or contact Lance at the state. Like I said, he's done a phenomenal job getting this all fixed up for us. So big thank you to him. All right, other resources that are out there. We have covid.sd.gov, doh.sd.gov. We have the Department of Health webpage for providers, rural health, and EMS. That would be the EMS page. And then the 10 a.m. EMS call on Mondays. I don't believe that's happening this coming Monday. So maybe check on Tuesday. I guess I'm not 100% sure on that. But if you want to be a part of that call, contact your service director if you're interested in attending that call. So let me stop my share here. All right. First off, does anybody have any questions on anything that I talked about there? We are not going to have a meeting next week. Kind of just announcing that right at the moment here right now. We'll probably do it again at the end. But we have decided with the short week, with the holiday weekend, we will not be meeting next week. So look for an email probably late next week for the following week. So we will not be meeting next week. We will be picking back up again that first week of June, and then kind of seeing where we're at with things to see if we're going to continue these weekly or bi-weekly or how we're going to do it. So if you have any opinions, any comments about how often you think we should continue to have these meetings, go ahead and put them in the chat box and let us know so we can take that information to make sure that we are getting you guys the best information and then also useful information as well. So if there's no questions before I start or before I introduce the next speaker to you guys, we will get to that. So we have Pam Fiechner with us again from Sanford here in Aberdeen, and she's going to kind of talk to us a little bit about what's been happening with their hospital. And since we've had an uptick in cases here in Brown County and kind of some of the surrounding areas, she will give us some info on how they're dealing with that. Take it away, Pam.
Okay, thank you. Can everybody hear me? Can you hear me?
A little quiet on my end.
Is it? How about, can you hear that?
How's everybody else hear her?
Not very well.
Okay, give me just a minute.
I just turned my computer up, so that might be part of my problem.
I can't hear her.
Ooh, I can hear you now, Carl. Ooh. Maybe I turned mine up a little too far.
Does that work better?
Actually, I think it's maybe a little bit worse.
Oh no.
We can hear you, but it's not real loud, so maybe we can just roll with it. It's just a little quiet, so maybe we can just go with it and see what happens.
I'm just playing with some settings.
That's much better, much better.
I'm playing with some settings here, trying to get it better. Okay.
Yes, much better.
Okay, great. Thank you. Thank you guys for having me back, and happy EMS week. This is your National EMS week, so we appreciate all you do in your communities, keeping your neighbors, your friends, your family safe. Today is also National Stop the Bleed Day, and many of you know that is one of my passions. I feel real strongly about making sure we get this out to everybody. So in this time right now where people are hunkered down at home and maybe EMS response times are longer because they're dealing with other issues related to the pandemic, it's just, and as the weather gets warmer, we know there's more traumatic injuries, so it's even more important now that we help spread the word. The American College of Surgeons has recommended no in-person classes at least through the middle of June, and then we'll kind of reassess where things are at after that. I also have with me Dr. Cara Dahl, who's our medical director in the Sanford Emergency Department. You'll say hi, Dr. Dahl.
Hi.
Hi, there you are.
Yep, I'm here.
Okay, thank you for joining us. She got off a little early today so that she could hop on the call with us. So let's talk a little bit about like kind of what we're doing in relation to COVID. We are seeing more numbers in Brown County. We are seeing more patients in the emergency department, in the clinic, in the hospital, kind of everywhere. And we knew this was to be expected with the surge was predicted. We thought it was going to be more towards June, but we're seeing, you know, an increase in patients now. So we are continuing to use droplet contact precautions with patients who are either under investigation or who are a known COVID. And that is mask, face shield, gloves and gown. Unless we're doing an aerosolizing procedure, like actually obtaining the nasopharyngeal swab for testing or doing a nebulizer or an intubation, those are all aerosolizing procedures. That would trigger us to then put on our N95s and our PAPRs. And that's because we're in an ambulatory setting and the patients are always masked in the emergency department. Once they go upstairs to the floor, they're allowed to take their mask off in the room. As you can imagine, this is a a lot of these people are impacted with a respiratory condition that makes it hard to breathe, and having to keep a mask on for the length of their hospitalization would be very difficult. So they take the mask off in the room, and the staff on the inpatient units treat this like an airborne bug, and they are in N95s and PAPRs the entire time for the hospital stay. So I like to explain that because some people think, well, why are you doing it one way in the ER and why are you doing it a different way up in the patient room? And that's the reason. The patient is masked, not masked. Also, patients are usually in the ER for a couple hours or less, but on the inpatient department, they can be there, you know, for days, and without their mask on, there can be quite a high viral load in the room. So we want staff protected with an N95 or a PAPR. Some changes, you know, as the state and the states around us are starting to open up more, we have relaxed our no visitor policy just today. We have started allowing one screened visitor who also needs to wear a mask in the emergency department 24/7, in the inpatient units from 8 a.m. to 8 p.m. And then we didn't make any changes to the birth center or the women's center or pediatric policy. They could always have one designated visitor with them 24/7 as well. So I think that will ease a lot of anxiety and stress for family members who have someone in the hospital. As we've all trying to find our way through this, obviously there's opportunities where it would be beneficial for the patient to have a loved one by their side. And so if we can screen those family members with the questions to make sure that they're healthy and they're willing to wear a mask while they're in the facility, then we are going to welcome them back in. So I know the last time we talked, I had mentioned if you were picking up a patient to come to Sanford, that not to bring the family member with you because we weren't having visitors at the time. But I just wanted to let you know now that they'd be welcome to bring one healthy family member with them. So testing, we do some testing in the emergency department, but we've really tried to have those things scheduled and not have patients show up unannounced that maybe have COVID. So we're doing a lot of e-visits, video visits, telemed visits with the clinic, and then they will get scheduled for a time to go around to the back of our building. If you've seen that, there are some white tents set up for drive-up testing. And it's still by appointment and with an order from a physician, but we're doing quite a few of those every day. And that is working well at keeping the patients with symptoms out of the building so that we can still take care of people for their regular and routine visits. The other thing I wanted to talk about was, you know, initially when we started to experience the changes that COVID brought to everybody, you know, PPE was kind of in short supply, and has gotten a little better as things have gone along. Sanford's been able to relax some of the reuse that we were doing. We are still being good stewards of our PPE, but we're wearing a new surgical mask every day instead of trying to save it and wear it for several days. Let's see. Oh, elective surgeries. So elective surgeries were a hot topic for a while, and we did stop doing elective surgeries for a period of time, partially because we were trying to conserve PPE, but as that has become less of an issue for us, we are starting to bring some of those surgeries back online. And as we do that, there are some guidelines around it, and we're being really cautious, making sure that we still leave at least 30% of our inpatient beds open, so that if we were to have an increase in COVID patients, we'd be able to accommodate and take care of them. Oh, and the other thing I wanted to share with you is we are also doing home monitoring. So if we have patients in our community who are positive and they have the ability to use like their iPhone or an iPad to do video visits, we will set them up with a thermometer and a pulse oximeter, and they will check their temp and their pulse ox a couple times a day, log that in their MyChart app, and then they're connected with a physician who will check in with them. And this has been a really nice program to kind of keep an eye on some of these people in our community who maybe are at higher risk for developing complications. And they are following them until they either recover or until their symptoms become worse, and at some point they need to come back into the hospital. But it saves some repeat visits where maybe things can be monitored at home. Dr. Dahl, did you have anything else to add about what we're seeing or what we're doing with the pandemic in our community?
Yeah, well, I think you covered a lot of the updates. I don't know if I'll go on video quickly here from home, but I will add that thank you for everyone's involvement and for what everyone is doing to help out in this community. But I must say that it seems like we are getting increased patients, and not just numbers, but also acuity. So it does seem like patients are coming in sicker, and I think that we're going to continue to see that. So it's not over yet. I think that, like I said, I appreciate everyone's work at this point, and I think we've got some time yet to go before we can kind of be on the other side of this. So, but I as far as updates, Pam, I think you covered everything well.
Dr. Dahl, do you feel like, for a while there, our volumes overall dropped quite a bit? Do you find people were staying home for fear of coming in, and now when they do come in, maybe for a non-COVID related issue, that they're sicker?
And that may be part of it. I think that the patients that are coming in with COVID do seem to be sick and more ill than initially. We haven't seen, I don't think, as much of the patient population that has, we've heard that people are staying home because they're afraid to come to the emergency department. I don't know if that's negatively impacted anybody that I know of yet because they delayed their care. We're being told that people are concerned to come in. And that's actually more of a nationwide thing that they're finding throughout emergency departments nationwide. Numbers have dropped, and we're not sure where the common routine, MI, strokes, appendicitis, where our numbers are for that. I guess here we are seeing still a lower volume in other patients, and not sure, once again, I'm waiting for that big influx back of all these patients that are waiting. I think we are going to start to see more acuity, people coming in with worsening CHF, worsening renal failure because they put off maybe something they should have taken care of weeks ago. But we haven't seen a lot of that, at least in my experience yet. I think that's to come. We are being told that patients are staying out of the ER. When they do come in, they said, well, I didn't want to come in, because of, concern of COVID, but at this point in time, numbers are still down. So we'll see that, I think, in the future.
Good. Thank you.
Yeah.
The other thing I wanted to mention to the group is that if you are bringing a patient who is suspected to have COVID, well, first, back up, and Kyle can probably speak more to this, but I believe dispatch has the ability to tell you if you are going out on a call that there is a positive COVID at that address. It may not be the patient you're picking up, but that there's a positive COVID at that address. Is that right, Kyle?
I'm probably going to defer that question to Patty Woods. I think Patty's on, and she'll probably have the definitive answer on that. Patty, do you know that answer?
Yeah, they are still, it's reported to dispatch. Sarah puts them in every day that she gets an update. And so it shows up on the call log that that patient is COVID positive or that household is COVID positive. And so any address that, you know, has been put in there, they're automatically, it'll pop up for on your Spillman and things like that for you to see. So yes, so they're still able to tell, as keeping it up to date every day.
All right, thank you, Patty.
Yep.
Yeah, one way to protect yourself. And when you are bringing a patient with suspect symptoms or a known COVID, we have a log sheet that all of our staff sign every time they go in and out of the room. But it's also helpful for you to know if you'll put your names on there or even your service. If we test that patient and they're positive, I am calling the services back to let them know that we had a positive test on someone you transported. So that's happened a few times, and so far, like, you know, I'll call the battalion chief at Aberdeen Fire and Rescue and let them know that was the case. Any other questions or things?
Well, I guess I had one, Pam, Kyle here. So Dr. Dahl talked a little bit about, you know, kind of the lower numbers coming through the ER. Are you guys seeing that? I mean, is your walk-in clinic open yet, or no? Are you seeing that same decline over there, or is that not open?
The walk-in clinic is open. Our acute care walk-in clinic is open from, I think the walk-in part starts at 10 and goes until 8 o'clock at night. And then the clinic providers are also still seeing patients. We're trying to schedule people for routine visits who are healthy, who don't have any problems. They just need maybe their blood pressure check or their annual physical. Those patients in the morning, and then patients with symptoms are being scheduled in the afternoon. So really trying to keep those patients separate.
Okay, and are those numbers pretty much the same as they've been, or do you have any idea? Are they
across the country? Healthcare numbers are down. Patients
okay?
Canceling procedures just because they're being cautious.
Yeah. Another question that popped in. So has the procedure bringing in a patient to the Sanford ER changed? Has the procedure itself changed?
No, if you just call and let us know ahead of time that you're bringing somebody in that you suspect that has COVID, we'll get all our gear on and we'll greet you at the door. Otherwise there's no change. Our line of treatment for patients. So the nice thing about being part of a larger health system, and I'm sure Avera is doing the same thing within their organization, is we have infectious disease specialists in Sioux Falls who have really helped develop kind of an algorithm with when you're first treating a COVID patient, where they hit on the mild, moderate, severe of their symptoms, and then where you jump in with treatment. So our treatment algorithm, depending on what the patient presents with, does include hydroxychloroquine. It includes Zithromax. We have given remdesivir in Aberdeen to some patients who were more sick. So there's a whole host of things available to us, and it's nice to have those specialists to refer to and try to keep people, you know, in their home community if possible. That's what we're prepared for.
I don't know if you can answer this question or not, but do you have any COVID patients currently in your hospital? Can you answer it or no?
You know, we report that out through HaveBeen every day through the Department of Health. I don't think it's a secret if you have access to HaveBeen, but we do currently have COVID patients in the hospital.
Okay. I did see something media-wise this evening, so take that for what it's worth, where they're saying that up to a third of the hospitalized patients are in critical condition. Are you guys seeing that as well, or?
We've seen a wide variety from people who are just needing some, additional oxygen because their SATs are low, to some that are really struggling with the low SATs and the persistent fever.
And obviously, one of the hotspot clusters is the Demcota beef plant. Are you guys dealing with a fair amount of language barrier as well, or how's that going for you?
It is. They have a lot of different languages spoken there. We use Language Line on an iPad for an interpreter service. The majority of the languages spoke are Karen, probably Spanish first, then Karen, and then Somali. And have our printed materials are available in all those languages for discharge instructions, and we have that translation available on Language Line.
One of the other questions that came through, actually got a couple of them that popped in. One from Diane down in Stratford. Today, I heard about this today. I'm sure it's been out there a little bit more, but New York was kind of reporting on a number of children who are dealing with some of the inflammation type issues. Are you hearing or seeing any of that either in your hospital, or are you hearing any of it in South Dakota?
I have not, and the Han alert that came out said that there were no known cases in South Dakota at this point. I was on a CDC webinar call earlier this week talking about that multi-system inflammatory multi-system inflammatory syndrome in children.
Yep.
They started seeing it in England and New York that talked about it, and that it seemed to follow a month after the surge in a community. Then they started to notice children that were critically ill with an inflammatory process that was like attacking multi-system organs. So that's, certainly sobering to think about, and we will all be on the lookout for that as the time goes by. Someone else is asking about patients in ICU for quarantine or a regular room. I'm not sure how many of you have been up on the third floor of Sanford, which is our inpatient unit, and it's really separated like into two wings just by the physical structure. And so we have patients who are there to have their appendix out or an ankle fracture surgery on one end, and the patients who are COVID positive or COVID suspected are on the other end.
Are you hearing anything in your correspondence that you're having with your groups of this second wave that people are talking about? I know it's kind of, nobody's really pinning it down. There's a lot of, there might be, there might not be. What are you hearing on that?
I don't know. My guess is probably as bad as anyone else's on that question. We'll have to see as things open back up, how much community spread we get. Supposedly, sunshine is a great disinfectant, so I'm hoping that as the summer months.
Yeah.
Yeah, I know. I've heard probably what everyone else has heard, that they're speculating that late fall we'll see another peak. But once again, it's all speculation at this point in time. That's what I've heard too.
Okay, thank you, Dr. Dahl. Yeah. We did have Governor Noem on last week, and she spoke to a kind of a new model that they were looking at, where it's not necessarily going to be this big all peak that we were kind of preparing for, but she kind of talked to us about it and said that it was going to be more waves, where we're going to have these up and downs and up and downs. Is that kind of what your guys' modeling with your health system is saying as well?
I haven't heard the waves term until Governor Noem, but it certainly makes sense. I know initially, our surge predictions were much higher, and as people stayed home and isolated, the numbers went lower and lower. So that was good to see. All that planning wasn't, for naught though. It was really good to have gone through those exercises of how you would handle this, how we would double or triple our capacity and still be able to take care of patients. So it's good to have done that planning.
Yeah, for sure.
A wave, I haven't heard that term yet either, but that makes, it makes sense. Once again, I think there's just different models out there. I haven't heard anything from Sanford in particular. It's just more nationwide data that I get. And so I have not, once again, heard anything necessarily through Sanford on what their model is. But once again, I think that they're thinking that late fall, because once again, it's the start of flu season, and then people's immune systems. I think that that's kind of what they're speculating, is that one of those waves are going to probably uptick during the start of flu season. So that's just what I've heard, and why they're speculating that may be so bad. But once again, I don't know if it's going to be as high of a peak either. I think that the wave model does make sense. I think that that's a potential model. So,
okay.
Yeah.
Thank you. Another question that came in was in regards to some of the mass testing that was announced last week through the Department of Health, more in the assisted living, communal care type stuff. Are you guys involved in any of that, or is that more the centers themselves that are taking care of that?
Sanford being aligned with the Good Samaritan Society, we are doing any Good Samaritan Society facilities, swabbing their residents and staff. Other facilities where we support with, going out and fit testing their staff within 95, but we are doing their own swabbing and then sending either to the public health lab or to a lab that they have an agreement with.
Okay. And this one may be for you, Pam, or Dr. Dahl, whoever. As far as people who are coming into the ER who maybe are COVID positive, are those folks coming in and letting you guys know if they're just coming in private vehicle, or are they making you aware of it? And are they taking a lot of the precautions that they need to be taking to come in?
I don't know. Some people call ahead, not always though, but right now we communicate, through our glass door so that we're not exposing staff until we ask our screening questions, and then we have them put a mask on and bring them in the department. So I feel like we've done some good work to reduce the exposure to staff, which is really important. Like, you'd want to be thinking about that too, to just have your mask and your gear on before you get within that, 6 feet of the patient.
Yeah, I think that we get some that do call ahead, like Pam said. The ones that don't, they're addressed pretty early on, because we screen every patient and any visitor with the question, do you have any suspicion that you have COVID? Have you been tested for COVID? So we're catching all of those at the door. So once they get to the department, we're taking precaution on those. And so I guess from at home, I think that the ones that I've seen that are in the community with COVID, from what they've said while they're in the ER, I think they're taking their precautions seriously. We've had families that have quarantined, and it's kind of unfortunately gone through the family, and they were trying their best to keep isolated. So I think that once they get to the department, we're taking, great precautions. We know, at that point before they even enter the department if they have COVID.
Okay, thank you. Do we have any other questions from the crowd? I did get one that popped in there. Should local chlorine treated pools be open? Do you guys have an opinion on that at all?
And I know obviously there's two schools of thought, because the Groton pool is going to be open this summer and the Aberdeen Aquatic Center is going to be closed. So there's probably some conflicting information on that.
Yeah.
I would say that once again, I won't answer either way. I won't pigeonhole myself quite to that extent, but I think that they would have to be still strict on social distancing. And so, like any other business, if they can come up with a model that allows for people to be distanced, I think that once again, it would be, you're outside, you're in a chlorinated pool. I think that it would make sense to restrict numbers and to be socially isolated. So I think it's like anything else. I don't think that necessarily would be going through the water system. It would still be are you playing with your friends and you're only a foot apart? I think that's really the concern. But I don't think it's going to be spreading through the water because, like you said, that the water is treated.
Looks like a question popped in. What's the purpose of testing nursing home patient if no signs or symptoms or mass testing?
No, that was something that the state wanted to do, and I feel like having watched like how many residents have been impacted in New York and New Jersey in nursing homes, I think they wanted to just get a handle on what do we have going on in South Dakota. Do we have staff that have it? Do we have residents that have it? And how could we isolate and keep it from spreading? That was the sense I've had in listening to the governor about why they decided to move forward with this.
Okay. And then another question that came in directly to me. Dr. Dahl, did you have something on that? Sorry.
No, I was just going to pretty much echo what Pam said, but I would say that it's because of the severity of once one person in the nursing home, especially if they are asymptomatic, it can go quickly and it spread quickly. So I think that it's a great screening tool. So I guess I'm in support of that because even for those asymptomatic patients, yes, we know we could get a false negative for sure, and that the next day they could be positive. But if we can even catch one or two people that would have snuck through and fell through the cracks and then expose the entire nursing home, I think that it's worth it. And I think that's what they're finding in other places.
The other question was, how are you guys holding up throughout this? This is week, 12, whatever it's been. Or more, so coming up on 3 months of dealing with this pretty hard. How are you and your teams and colleagues holding up with this?
That is a really sweet question, and I appreciate the concern. We put in a lot of hours initially up front. These were all new workflows. We, as an ER, had never been fit tested for N95s. We had always worn PAPRs if we had the occasional suspected TB case or something like that. So we had a lot of training to do initially, and like I said, we put in some long hours up front, but now we feel like we have some of our workflows down and kind of getting used to the new normal at the moment. So we're hanging in there. We have been fortunate in that we have not had any staff that have been impacted. We haven't had any staff that have contracted this, or I'm sure in some of the other facilities when they, start having their staff have to stay home because they're sick, that makes things even tighter on staffing and just be wary about your coworkers. So right now we're hanging in there. So thank you.
Yeah, I would say the same. I think we did a lot of planning up front. At this point in time, I think the warm weather has been a blessing. All of us are getting outside and really enjoying the spring. And it's we're doing well. Thank you.
You're welcome. Do we have any other questions, comments? You can unmute and ask a question yourself if you'd like, or drop it in the chat box. Anybody else? Do you ladies have anything to kind of finish it up with, or are we good?
I think we're good. Thank you again for having me back, and let me know if I can be of help at all. If anything, Dr. Dahl and I could reach out if you need education or training on something. We're happy to be part of that.
Once again, we appreciate everyone's work. We really do. It's a team effort. So thank you.
Well, thank you guys for coming on. We really appreciate it. And we appreciate your knowledge that you have in this, seeing it kind of definitely on the front lines of it in your hospital. So next off here, I think we're going to go to Carl Perry. If Carl has anything to talk to us about.
Well, I can. Thank you. I'm a representative for District 3, and I sent a note to Kim Molson today, Ryzen, and some of the things that I was concerned with are really just, I'm amazed at what they've been able to accomplish and what they do and how many people they talk to. But I told them we have 221 cases in Brown County. We have 130 at Demcota. We have 94 active and 76 at Demcota. These are some numbers I had. No deaths and 10 ever hospitalized. And then I visited with another representative that's really active down in Sioux Falls. And she suggested that we check our boots on the ground with Demcota. And I visited with her, and the question was, are we giving information in the native language of the workers? Are we providing PPE? Are we taking care of barriers and sanitation? And then on nursing homes, you know, are we looking at isolation issues and testing issues? And basically, within an hour, Kim got back and she said, "Hi, Representative. We have provided education to Demcota, positive cases in their native language," which was important because someone told me that we're not talking to them in their native language. And I wanted to know that we were. And you might be interested in the resource on their webpage. They have the https://covid.southdakota.gov/ESL.ASPX. And so that information is there. And they've done a couple of on-site reviews of the facility. And they've also provided face masks and face shields. And they have also added physical barriers, and they have adequate hand sanitizing. And she wanted to tell me that Demcota management has been very responsive to remediating issues and answering questions. And so what I'm saying here is that I think our Department of Health is doing a really good job. I think the fact that our governor comes on almost every other day or every day and tells us what's going on is very important. The fact that we have Vera, Sanford, and Monument Healthcare Centers working together, and the fact that the legislative units are keeping informed, I think all that's important. Long story short, you guys are doing a tremendous job. Healthcare is very important. We have you in our prayers. I'm in several prayer groups, and you guys are always in those. And I'm really appreciative of South Dakota AHEC and the things that they do, because they're one of the catalysts working on all this stuff. And the same thing with the South Dakota EMS. We have some pretty tremendous people in South Dakota, and we should be proud of what we're accomplishing. Kyle, I don't know if that's what you wanted, but that's what you got. Thanks.
I appreciate it, Carl. We always appreciate you being on the call and giving us the info. We really appreciate it. Going next to Michaela or Sandy, if you guys are on the call, do you guys have anything tonight?
This is Sandy. We just are very pleased at the attendance on these calls and that it's continued, and also for the expertise of the individuals that have presented. And Kyle, thank you for all that you've given and your leadership. I hope all the EMS world appreciates you as much as AHEC has learned to. So we want to make sure we continue these calls as needed. And so that's why we really would like people to get on the chat and tell us what they think about the times we could continue if we want every other week, or what they'd like to see. So that's it from Sandy Durek at AHEC.
Thank you very much, Sandy, and thank you for the kind words. There's no way that I could have done this without you guys. So the partnership has been great, and the participants have been great. We couldn't have asked for better results from this. It looks like we're getting a lot of folks saying that they're preferring every other week. So when we have our planning meeting next week, we'll definitely take that and use that and kind of go from there with that. A couple of things that I kind of want to share with you guys is I did receive a very brief, short email on Tuesday, it was, from one of Governor Noem's staffers saying that they appreciated us inviting her to be on and that they really appreciated the number of folks that were on the call. So they were very happy to see that, and they liked being on, and they did offer to come back on if we ever wanted them on again. So that was great. One thing that I'm kind of working on for our next meeting is trying to, since my new office is actually in the Department of Health building here in Aberdeen, I'm making some contacts there, trying to see if one of their folks who does some of the contact tracing would be interested in coming on and kind of explaining that to us. And then also we did have a couple of folks that texted me with some thoughts on what we could do for the next meeting. So yeah, we'll be looking at that going forward, and continue these probably, I guess, every 2 weeks is kind of what the thought process has been coming across as. So we will not meet next week due to the short week with the holiday. We will meet the following week, and then we'll kind of announce the direction we're going to go from there. Does anybody else have anything? Michaela, do you have anything tonight?
Nope. I just want to say thank you guys for all your services that you guys have been providing over this time, and we appreciate you guys coming on to the chat.
I am going to go to somebody else if she has anything. Patty Woods helped us out with a question earlier. Patty, since you're kind of working with the EOC, obviously, a big part of that, do you have any updates as far as that goes, or would you want to share anything with the group? Kind of putting you on the spot, I know, but you're good at that. Do I still have Patty on? Oh, I think she must have had a drop off, but we'll catch up with her next week. All right. Well, if we don't have anything else, again, one last call for any questions, any comments, any concerns, anything out there. See some good chat stuff going on. That's what we like to see. Happy EMS week. Again, I feel terrible for not bringing that up. Thank you, Pam, for reminding me of that. Appreciate that. Well, seeing no other comments or questions, we will go ahead and adjourn for the night. Have a very safe and happy Memorial Day weekend, and we will talk to you all the first week of June. Have a good night.
Right.